Hello again, everyone. Now we're starting with our flash session 06, which will be the last one for today, and it's on the topic of AI, robotics, and health. It's my pleasure to present to you our key participants, the facilitator, who is Jacques Beglingen, attorney at law, DESSS, at Beglinger LPC. Sorry if I pronounced this wrong. The moderator is Amali de Silva Mitchell, IGF DC DDHD. And the presenter will be Dr. Joao Roja Gomez, IGF Dynamic Coalition on Data-Driven Health Technology. Again, apologies if I mispronounced something. And now I give the floor to you. Thank you.
Hello. Bonjour. Thank you for joining us today. My name is Amali de Silva Mitchell. I'm the coordinator of the Internet Governance Forum Dynamic Coalition on Data-Driven Health Technologies. And we are very pleased to have Joao and Jacques join us for this session. So I just want to, as we have very little time, I'm just going to rush through this and say, please be welcome to you to join us at the Internet Governance Forum to discuss this topic in depth. But today we want to share with you some highlights from a report that we are all writing together, and including participants from all venues where we have held these discussions. And we'll be finalizing it at the end of this year, but please feel free to join us and contribute to this report. So I just want to say that we are a group that's patient focused. So we are a group of doctors, nurses, and mainly patients. So we have a perspective when we're looking at robotics and health and artificial intelligence from the patient and family perspective, so a public perspective. And we know that all the stakeholders are joining together in a multi-stakeholder environment to contribute. But there are some particular areas of concern, and we are in a venue where human rights is under discussion, and we really appreciate this. And it's really looking at what are biases, what are pattern settings, can they lead to discriminations and bias, and are people being left out as well? So we're very concerned when it comes to that, when we're talking about healthcare and providing healthcare and robotics in healthcare for these kinds of marginalized groups in particular. And then also making sure that these large models of generalizations are accurate, because we're dealing with a human life here, and we're dealing with the repercussions for the human being. So there are no excuses. We can't go back. We need to proceed, with very safe human conditions. So we want to make sure our ethics are good, our values are good, human rights, as we talk ESG, which is environment, social, and good governance. We want to make sure they're very low on nil harms, make sure that we are really investigating our risks and cybersecurity. So on this note, I'm going to hand this over to Dr. Roja Gomez, who will walk us through the paper. And then afterwards, we can perhaps have some questions at the end and input that would be really appreciated as well. So I'm going to pass this over to Joao, please.
Hello, I hope you can hear me well. I will also share my screen. I prepared a short presentation to make it easier to go over the paper instead of providing you with the bulky share outs of the documents. I thought it would be easier to digest if it was through a presentation. Once again, thank you so much. And also Jack's in the room for the availability, and Amalie for the words of introduction. First of all, I would just like to say that this paper was developed jointly by a group of people that is not limited to the Dynamic Coalition on Data-Driven Health Technologies. So the idea behind it was to integrate a vision from the community and different stakeholders on what are these challenges, not just from an ethical perspective, as Amalie so well emphasized, but also from a technical standpoint. So almost as a dilemma or dichotomy that supports these worlds of robotics in healthcare. And now robotics can even go beyond it if we consider the automated systems and AI technologies that are not physical, but still depend on automation. And this is what this paper entails. So first of all, I would even like to start by saying that This paper started as an idea that was explored in 2023. So there was a lot of focus from the work that was done by the Dynamic Coalition on this topic of robotics. So we decided to dive a bit deeper and explore what are the different options and alternatives that one could consider when thinking about this topic. And before I do so, I would just like to share a list. I try to be as exhaustive as possible, but here are the names for accountability, but also for appraisal of the contributors to this paper. And as Emily also emphasized, this is in a way still a living document. So if you feel like you have considerations that you can make, additions that you would like to do, we are very much welcome to add them to the paper. I believe we can also link documents to the EuroDIG page. So I'm pretty sure that this presentation can live there, even if it is for checking the references, because definitely the slide with references is not readable as it stands. But you can then explore it, and also to get our contacts so that you can later get in touch with us and even add your contributions to the paper itself. So starting exactly with the work that was developed, obviously when we think about the introduction of robotics into healthcare, this is no longer a vision of the future. This is already happening. We can think about the robotic assisted surgery, for example, the Da Vinci systems that are widely used now for this type of assistance in healthcare, but also for robotics rehabilitation and even the telepresence of robots for remote patient monitoring, which are becoming even more so important these days. So the promise is quite big when we think about it. In a way, improving patient outcomes are one of the assets that these robots can bring, but also lower risks and potentially the faster recovery times with greater efficiency, which is ultimately the goal that we should strive for, meaning that it not necessarily links to reduced costs, but improved outcomes overall. And this aligns with this vision of the Industry 5.0, where robots and humans are not just working in parallel, but they are working hand in hand collaboratively with technology designed to enhance and not replace the human care. But we must also be realistic as this challenge that we see in here. Robots also bring a serious challenge, and healthcare deals with highly sensitive data. So when we think about this, we also think about the challenge of privacy and data protection. And there are profound ethical dilemmas around the human autonomy aspect and dignity when we consider the usage of these automated systems. So we must also address this question of the liability. So if we think about the aspect of potentially a failure in one of these systems, who is accountable? Is it the designer, the user, the hospital, or even the manufacturer? But also the aspect of equity. So we cannot think about these types of tools as a luxury for few, for the ones who are able to afford it, leaving the most vulnerable communities outside. So these are questions that are at the heart of our work and challenges that obviously we identified and are really present in this exploration. So we believe that robots as a baseline definitely must be human-centered. So our framework proposes 5 different critical ethical pillars that must be considered. The first one addresses this last point that I just mentioned, the data privacy and cybersecurity. So we know that there's a vast amount of data that is collected by these systems, such as vital signs, activity levels, even the emotional states of our patients. So we must really ensure that design considers protection of these types of data when they're being developed. Either it being strong encryption, secure storage. Here I'm also touching upon, obviously, the technical aspects, but also minimal data collection and storage must be mandatory for these types of tools and not just an option. Secondly, the aspect of accountability. Again, if we think about a misdiagnosis of a patient or a delay in a treatment, a malfunction during a surgery, the legal systems today are not fully prepared to actually address the main question, which is who is going to take responsibility. So we need clear accountability frameworks, not just on a national, but also common ground on an international level. Then the third aspect is transparency and explainability. So this is interesting because we just heard the hackathon session right before us, and this is one of the aspects that was also mentioned during that session. And especially in healthcare, this is particularly important. So we need to know how decisions are made, and it's critical to build trust because it's not just about the user, the healthcare professional, but also the person we are using these tools in, the one who is ill, And it needs to trust the tool, and these tools need to be reliable and need to be able to justify their recommendations. Then the fourth aspect is the fairness and equity. If, again, we just consider the deployment of these tools in flagship hospitals, we are definitely leaving others behind. So the aspect of scalability and affordability should always be considered when developing these tools. And then the human-robot trust. So patients can feel anxious when using these tools, but if we consider that these tools should be designed also for emotional comfort and support, as not a replacement, but of a support to clinicians and healthcare professionals, then we can potentially think about the usage of these tools in a more safe and intuitive way. Then, when considering the technological or technical aspects, there are 5 key aspects that were identified. Some of them are intertwined. I can already link the first one with the fourth. So the aspect of the hardware and software integration and interoperability. So we need tools that are reliable and that cannot be compromised. And these systems must still work under extreme conditions, either in surgical theaters and with no room for error. But if we think about this, we also think that these tools need to be embedded in the systems that already exist, which touch upon the point 4 that is emphasized in here. So these systems must be able to exchange data and to understand what the data refers to, even when used in different ecosystems. Then, if we look at the second point, the power and connectivity, we also must consider that robots cannot stop working due to a power cut or poor Wi-Fi. We must still design backup systems and consider energy resilience, including off-grid solutions for rural areas, so that we don't create a dependency on these types of infrastructure. Then the aspect of data security and cybersecurity, again, as I mentioned before, it's not just about an ethical dilemma, but also a technical standpoint. So protection must be multi-layered, and usability and training as the last point. Healthcare professionals do not need to become engineers. So interfaces must be intuitive, and structured training must be provided by the developers so that the users or the end users know how to use these systems. At the end of the day, it's definitely a balance. So we can think about the aspect of job displacement as a negative standpoint, but also other jobs will be created, either for maintenance, even data science, as we heard before, trainers of the ones that are going to provide data for these tools. Definitely, we see a challenge in costs because it's actually the main drive for the increased cost in healthcare. It's the aspect of technology over the past years. So we need to think about how to make it sustainable. And in the long term, definitely these technologies, if they improve the outcomes, they can reduce the cost eventually, reducing the complications and enabling faster recovery of patients. So the path forward and our message is very simple. So we need to act together so that we urgently intervene in harmonizing the international standards and create frameworks that work independently of the nationality. So ethics, safety, and data protection must be considered when developing these tools. And if it's true that there is this revolution on the usage of robotics and automated systems currently or happening over the next span of years, we must also govern it by what is responsible, not just by what is possible. And it is this shared mission that we wanted to share with you. So again, as I told you, it's a reference slide that is difficult to read, but we will obviously upload this in the platform so that you can explore each of the references that we have in our paper. And a last note as a thank you to all the contributors to the paper itself, also the ones present in the session today as listeners, and to Dynamic Coalition on Data-Driven Health Technologies, which in a way was the group of people that conceptualized the paper and that kicked it off. Nonetheless, it had many contributions. So a thank you to you all. And maybe I'll pass now the floor or the word back to the room where we can have questions.
Thank you, Dr. Joao. That's very, very helpful. Thank you for highlighting it very, very well. So Jacques, perhaps, is there anyone in the room who may want to ask a question? And I'm going to leave it between you, Jacques, and Joao to please manage this. I have a very bad cold, so I'm going to.
Thank you for getting here the floor also in play. I do not see questions right now in the room. I also do not see questions online, but let me ask one question, which is the following, but it may be a far shot. Some of you may be familiar with Asimov's laws of robotics. And this is, well, a set of rules developed in the mind of Mr. Asimov some 60 or 70 years ago, which was already putting human interaction at the center. Now, if you have knowledge maybe about it, could you explain what is more in it than what has always been some thoughts on how people should interact with machines or vice versa? So is there anything new here that one didn't think of 20 years ago?
Maybe I can add some words on this as a word of reply at least. This is very true indeed. I think that one of the biggest statements that come out of the law is the aspect of harm, which is very much present in the regular practice of healthcare. So not expecting robots to provoke any harm to humans. And this is exactly the same principle that is used when delivering healthcare by humans as well, when we are even disconsidering robots. The important aspect is in here is to make sure that what is being said actually meets its ends when treating the patients. So almost such as bringing a theoretical concept, which is what Asimov proposes, to the real world practice, because we are now seeing other types of technologies. And that's why even in the beginning, I mentioned it even goes beyond robotics now. We are talking about automated systems that make decisions, even using LLMs. And there's this aspect of explainability that still stands, and it's new compared to the Asimov's law. We didn't have this issue at the time. But in a way, it is a parallel aspect to automation, which is how do we deal with systems that work in an automated way? And are we able to implement it, taking into account the world that we live in? Because as you said, I think it's very holistic, but it's still theoretical, taking into account the advances of technologies these days. But you actually just gave me a great idea, which is to reference these in the paper. I don't believe this is referenced there yet. Or if it is indirectly, because I do remember going through this when I was reading through the suggestions for the paper. But it's not directly referenced as the laws themselves. So I guess this is already a good addition that we can make based on that statement.
Thank
Yes,
you.
thank you. Question, Jacques. That's very important. And just looking through that history of time is very important. And it's probably something, Joe, perhaps we should discuss a little bit further, and seeing this evolution of technologies, and especially that social thought process and the risks and harms that perhaps were there originally. Perhaps we have remediated now, but we are going to see more into the future. And for instance, cybersecurity is very worrying as to what it could do to robots. And quantum is going to bring another picture into this. And I think there's more of a behavioral science that I see now that is appreciated in actually public policy, just in economics and public policy, which wasn't there 30, 40 years ago. And this will have an impact on how we develop systems and how systems for healthcare will be approached. And that's another item that we want to bring in as well, that we've been discussing recently. So I'm just going to leave it there for myself. What about Joao? I'm going to leave it back to you.
No, I believe this is, those are great ideas. And definitely they should be referenced as they are. And again, I would even end the way I started with the aspect of first, do not harm. This is a guiding principle in healthcare. And it really goes hand in hand with what is suggested by this set of rules. So I definitely could even consider including these aspects in the paper on a deeper level and discussing what is the actual difference to even opening a new chapter or even a new paragraph specifically addressing this question. I think it would be very relevant for the paper itself. Yeah.
But at the
when
same time, sorry.
first paper, ChatGPT was not available to the public, as it were. It was, it's in infancy to the public, but now it is, and we can have patients who will go and ask the question of ChatGPT. How do you approach this kind of issue as well? So I think we're getting to a very sophisticated time where the patient, especially, and the family can ask many questions and get lots of answers, and they will then provoke or request standards, from the medical community, from the justice system, and especially of human rights going forward. So it's actually a time we're going to see a lot of evolution, I think. And as Joao mentioned, this is a living paper for us. So this will be version 1. And then after this, we will update it into the future as we hear back from all of you. Thank you so much.
Well, may I advance, although we are almost at the end of it, one additional question, which it goes totally different direction, which is health AI finally the end of the general practitioner, the GP, as we know it? Some kind of a friendly person in charge of some kind of long-standing family friend. Is he going away?
I hope not, because as our new Pope Louis XIV has said, Leo the 14th, the human must be in the loop, and it's very important. And when you're looking at medicine, it's not just the physical. You have an emotional. You also have to think of the spiritual, and I think it's very important. That's just as a patient. Just as a family person, I'm just saying, I think it's very important that the human is always in the loop. And Joao, I'm putting this over to you. What do you think?
Yeah, I'll even add something to this because it is quite recent, and you even mentioned ChatGPT, but there is a system that was even released yesterday called Health Bench, which is actually a benchmark for these systems that try to replace the healthcare professionals, or even to provide healthcare information to healthcare professionals. It doesn't have to be patient-centric or patient-focused. And I think we are definitely going in the direction of having these systems working better on a very objective level than humans, because this is the direction. We have enough data to allow these systems to work very well, or even better. And there are still obviously the challenges of how this is communicated and accountability, explainability. But at the end of the day, if the equation leads to better results, that's what we all should strive for. And we definitely should not be leaning away from that, waving the flag of having the human aspect or just being human-centered just for the sake of it. Of course, this still needs to be considered. We still have humans on the other side, and humans that have needs that go beyond healthcare. Sometimes delivering healthcare is not just delivering the treatment, it's the entire process of treating the patient. And there's still where I think that humans adds value to this chain of care. But definitely, we definitely need systems like the health bench, because the issue is that we start to have these tools that are not regulated or not benchmarked against anything. So if we create a standard of what can be a good answer in terms of healthcare solutions or recommendations, then we can analyze and measure, because we cannot ever advance in what we cannot measure. So we definitely think we definitely need a model like this so that we can promote advance. Yet again, I do see these systems with a great view. I do work even in that space. So I even have a positive conflict of interest. I'm playing devil's advocate here. But obviously I do see that there is strong interest by the community, because at the end of the day, what counts are the healthcare results and the healthcare level of our populations.
There's also a comment, sorry, but
just also wanted to mention that why robotics is really important is we are not reaching out to the population totally. There are lots of tracts of population that don't have any healthcare. So robotics has that opportunity to bring healthcare to remote locations and so forth that we won't be able to otherwise have, but still that human must be in the loop. Sorry, Jack, go ahead. Please say what you say.
Well, since we have an intervention in the room, please.
Thank you. My name is Lars Lüneburger. I worked for a medical device company in the robotics field some years ago. And thanks for bringing up that topic with robotics briefly, because I think, Jacques, your question about replacing the GP, the remarks are very important. The human has to stay in the loop. But there's also the aspect of taking blood, taking measurements, and the robotics is, I think, not there yet to really take that over. It's not only the human interaction aspect, but it's also a purely technical thing. I think I don't want to go into a box like a phone box and put my arm in to get blood drawn from some machine and then some AI afterwards telling me what the contents are. There is a bit more, I think, about that physical interaction, which robotics over the time could deliver, but I think it's not there yet. Thank you.
Would you venture a prognostic? So a forecast? Are we talking about 10 years or 20 years or never?
Less than 10 years, if you wanted. I think there was a European research project on geriatrics that had a bit of an idea of such a health measurement booth, but for blood pressure, heart rate, and stuff like that, nothing invasive. I don't remember what came out of that, but that was 5 years ago and I haven't heard of it. But in terms of technology, I think it can be pushed a bit. But regulatory, 5 years definitely is, and a bit of research on top of that, perhaps. That's to answer that.
Thank you very much. I think we are, well, here in the room, I think looking at the watch, I think it's the end of it, but I'm giving back to Amal.
Thank you so much, Jacques, for moderating for us on the side. We really appreciate that. And Dr. Joao, thank you for the presentation. I want to see, I think what we're going to see into the future is devices being made, autonomous devices. We have blood pressure machines that can be used at home, diabetic analyzing machines. So I think we're going to see these small little machines being developed, and then afterwards someone's going to put them all together. I think that's what we'll see. So I think we're going to see a lot of patient care in the home. I think a lot of municipalities, government bodies are wanting patients to be at home, and that kind of monitoring will be developed at home. Because it's very costly to have patients in care facilities, in hospitals, and so forth. So I think we're going to see this online development of smaller technologies that then will come together into the future. I'm not sure, Joao, what do you think, for instance? And please close off after that as well, this session.
No, thank you for the interventions. And it's definitely true. Like we see that when practicing in the hospital, there's always the need for human interaction, even if it is from just a purely technical standpoint. We must also consider at what level we need this interaction to be. So we do need to, is it mostly physical work that needs to be compensated by the introduction of these tools? Or is it actually more rational work or analyzing data type of work that is being replaced by these types of tools? I obviously see this going in that direction. So for both parts, I'm not sure if I would be so optimistic on the 10-year timeline. As you said in the room, I definitely agree. If we make a push, we could. I just don't think there is a strong will to do that push now from all parts. So it may take us a bit more to get there, but definitely not an ever, as it was also mentioned by Jacques earlier, and early to come. I think still during our times in here, we'll get to see that. But again, once again, thank you for the contributions. These additions will definitely be made to the paper. Even this last remark that was made, and mindful of time, I would then like to propose closing the session. And yeah, I will not send you back to the room, Jacques, just as you already had spoken as well. But once again, thank you for the participation from the room, and as well, Amalie, for your organization. Thank you.
And thank you from the room for you online who prepared this flash. So wonderfully and really inspiring. Thank you so much, everybody. Nice evening.
Thank you.
Thank you very much, everyone, for the great presentation and the interesting and innovative discussion. Thank you also for participating, for everyone in the room and online. This was the last session for today, so we wish you a great evening, and we'll be looking forward for you tomorrow to join the sessions. Thank you.